Hi, I'm Dr. Dino Prado, the founder of Envita Medical Centers, and I'm happy that I can be with you today and with Sandy Yazapovic, who is one of our star pupils. She's been with us since the very beginning of Envita, almost 11 years ago now. And she's such a great story because she can really give you the inspiration, the understanding of what a cancer patient goes through. Now, I remember with your story, Sandy, tell us a little bit about, first of all, the major big cancer clinics in the country that you went to, because this is important for people to understand. And tell them a little bit about what happened.
Well, the journey began when I heard, what my diagnosis was. Though it was shocking, I was 39 years old. I had a 7-year-old and a 12-year-old, and my husband and I decided to get second opinions. And so we went to the top major cancer centers, Mayo Clinic and Sloan, and found that they both had the same prognosis, the same diagnosis, and the outcome was still only a 20% chance of survival. I said there had to be other options. And I thank God that Mark was very diligent and persistent on doing his research online and finding, talking to other doctors, especially in the natural field, that referred us to the Envita Medical Center. And so my story came to be, is why I came to Envita Medical Center, because it was the only center that offered me a solution to my problem, because they got down to the cause of why I got cancer in the first place, which nobody told me that. They were just going to give to me what they give everybody else who's my standard height and weight and my diagnosis.
Right.
Same protocol for everybody, no matter what.
Yeah, and I think people don't understand that, basically, that what happens is with cancer is the major cancer institutions are using the same protocols, because it's the same specialists that are doing the same therapies.
Sloan uses Mayo's protocol.
And of course, there's a place for those protocols. They have a place in cancer treatment, but a lot of times with advanced cancers, more difficult cancers, they're not as effective as people believe. And so what I want you to continue, Mark, by the way, is your husband.
Yes.
He was the guy who did all the research and the work. And we've all become good friends over the years now. And one of the things is Mark was researching. Now, tell me a little bit about, during your journey, what was going on with family dynamics and everybody, all the voices speaking to you of what to do, what's going to work, because frankly, cancer's scary to a lot of people. When they hear the word, they don't know what to do. Share that with us.
Well, it's an instant death sentence when you hear the word cancer and you're diagnosed with an advanced cancer such as mine. But what the difference between the other cancer centers and Envita Medical Center was, we were educated on why I got cancer and how important nutrition plays into a factor, and then rebuilding the immune system, and how immunotherapy is so important in fighting any chronic disease, not just cancer. And that became an education for us. This became an education source for us, that it fueled us to find out more. And why didn't other people know about this? Why weren't the traditional or conventional medical centers educating and offering the same advice or the same teaching or the same principles? And it was common sense for us. But when it came to the family, the common sense wasn't there, because they didn't know from an educated standpoint what we were researching, why we were researching it, because most people, most families trust their doctor. They trust the center that they're at, because that's what tradition speaks. You had a doctor for 10 years, 20 years in your family, you're going to do what that doctor advises you. And most people put all of their trust into that one doctor who maybe not even be a cancer specialist. I went to the head oncology. The head oncologist did not know anything about immunotherapy once I was administered the chemo. Well, how do I rebuild my immune system? I was told not to take multivitamins. I was told to cut down on my vitamin C intake. I was told not to eat fruits and vegetables for at least 1 year after my last chemo treatment, which went against everything that I was being taught to. So of course our friends and family provided a lot of pressure on us, because they were upset because they didn't understand. They just didn't have enough information to go by. So the communication became explaining what it is and why we were doing it.
And it's tiring.
And it was exhausting. And so that's why I wanted to create an outreach for other patients, so that they didn't have to go through what we went through, because this is almost 10 years ago. And back then, there wasn't even the research or what's available online in the naturopathic field or in the integrative field now, as there is today. This is the future. This is the norm now, is you have to be able to fight every disease and chronic disease or cancer with everything in your arsenal. You got to be able to come at that cancer with an army and not just have one or two things and leave it to chance because the statistics are too high. Is that your phone?
Yours or mine?
That was yours.
All right.
Sorry.